How to cure bad breath. Hello and welcome to Video Jug. Bad breath is very common, affecting 1 in 4 of us at some time in our lives. Temporary bad breath may be caused by eating spicy or strong-smelling foods, smoking, drinking, crash dieting or fasting. Persistent bad breath may be a sign of a medical issue such as gum disease or stomach and nasal problems. We've spoken to the British Dental Health Foundation to bring you this advice on dealing with bad breath. Step 1. You will need a fluoride toothpaste, sugar-free chewing gum or mints, and mouthwash. Step 2. How do I know? It's difficult to tell if your own breath smells. An easier indicator may be the reactions of other people. Do people back away slightly when you start to speak? Do people turn their cheek when you kiss them goodbye? If you're worried you might have bad breath, try this simple test. Lick the inside of your wrist, leave it to dry for a few seconds, then sniff. If it smells bad, your breath may too. Some people's bad breath is as a result of gum disease or infection. If this is the case, it will often be accompanied by visible signs. If your gums appear swollen or bleeding, then this may contribute to your bad breath. You should seek advice from the dentist. Step 3. Avoid smoking, alcohol, or spicy food. Smoking is one of the primary causes of bad breath. When you smoke, the chemicals in the smoke create a lining on the tongue which causes a lingering smell of stale tobacco. The only remedy for this is to kick the habit. Watch Video Jug's Top Tips for Giving Up Smoking for more on this. Dehydration, a common side effect of drinking alcohol, can make bad breath worse, so if you drink a lot, try cutting down your intake. Also, avoid foods containing a lot of garlic, onion, and strong spices, as the smell of these can linger on your breath. Step 4. Eat a healthy breakfast. Quite apart from the well-documented health benefits, a healthy breakfast can help with bad breath. Eating a coarse breakfast cereal like muesli or a variety of hard fibrous fruit can help to clean the tongue as you chew and rid the mouth of odor-causing bacteria. Make sure you brush your teeth after breakfast, though, so that you get rid of any food stuck in your teeth. You should wait an hour after eating before brushing your teeth. Step 5. Brush teeth twice a day. Overnight, saliva flow is drastically reduced and the tongue and cheeks move very little. Food residue and dead skin cells from inside the mouth do not get washed away as they do during the day, instead remaining in the mouth and stagnating. The result is the bane of early bird lovers everywhere, commonly known as morning breath. Brushing your teeth first thing in the morning should clean the mouth and get rid of the bad smell. During the day, any number of foodstuffs pass through your mouth, leaving their residue to make its mark on your breath. Cleaning your teeth before you go to bed helps to clear the mouth of the food remains which would stagnate so well overnight. Brushing your teeth twice a day also helps to fight plaque and reduces the likelihood of gum disease, both of which are contributors to bad breath. Watch Video Jug's How to Brush Your Teeth for some tips. Top tip. Food residue and bacteria can also build up on your tongue and if left to their own devices can cause a bad smell. While brushing your teeth, use the toothbrush to firmly but carefully brush the top and sides of your tongue. Step 6. Mouthwash. Mouthwash can be an effective way of masking the bad smell of your halitosis, but will do little to deal with the root problem. If you're going to use a mouthwash, you should make sure it's alcohol-free and that it contains fluoride. If you're suffering from gum disease, your dentist will be able to recommend a medicated mouthwash which will help to treat the problem. Step 7. Chew sugar-free gum. The mint flavour in most chewing gums will mask a bad odour, but chewing gum also has longer-term benefits. Chewing encourages the flow of saliva, which helps to shift those odour-causing bacteria and neutralises the acid in the mouth. Make sure that the gum you choose is sugar-free, otherwise you run the risk of the sugar rotting your teeth. Step 8. The dentist. If you've tried all of these things and you still have problems with bad breath, It's possible you could be suffering from a more complex medical condition such as acid reflux, which is stomach acids returning to the throat during digestion, or you could be having problems with your tonsils. Your dentist may refer you to your GP for an ear, nose and throat checkup. Done.